Hi everyone, welcome back to the Audible Dentist. This video covers MCQ from the BTSC Dental Exam. If you want explanation for any question, just comment the question number below and I will reply with the explanation in the comments. This way, the video stays short and focused and you still get help where you need it. So let's get started. Question number 31 is, in a patient with a history of penicillin allergy presenting with a periodontal abscess, which antibiotic may be opted for treatment? Option 1, erythromycin, 2, clindamycin, 3, ampicillin and cefixime. And the answer is 2, clindamycin. Question 32 is, which of the following is a critical factor in differentiating a abscess from a periapical abscess? Option 1, presence of tooth inability in periodontal abscess, severe pain in periapical abscess, radiographic finding of bone destruction around the apex in a periodontal abscess, pulp vitality test showing no response in a periodontal abscess. And the answer is 1, presence of tooth inability in periodontal abscess. Question 33 is, which of the following terms refers to the growth rotation of the mandible? Rotation growth, vertical growth, differential growth, anterior-posterior growth. And the answer is 1, rotational growth. Question 34 is, which of the following is a characteristic clinical feature of TMJ ankylosis? Progressive limitation of mouth opening with reduced condylar movement, painful clicking during jaw movement, deviation of the mandible on opening, bilateral dislocation of the condyle, and the correct answer is 1. Question 35 is, carious lesion originating on the root are considered more alarming compared to those on the crown because of all of the following except they are closer to the pulp, they are difficult to restore, they are distressing pain, they progress rapidly. And the correct answer is option 3. They cause distressing pain. Question 36 is, according to NICE guidelines, what is the recommended target oxygen saturation range for a patient with chronic obstructive pulmonary disease (COPD) who requires oxygen therapy? First, 88 to 92%, 92 to 96%, 96 to 98%, and 85 to 90%. The correct answer is option 1, 88 to 92%. Question 37 is, which of the following is a method used in caries prevention that involves the placement of a physical barrier on occlusal surfaces of teeth? Option 1, Pitten-Fisher sealant, composite restoration, scaling, fluoride application. The correct answer is option 1, Pitten-Fisher sealants. Question 38 is, which of the following dental cements is most commonly used as temporary luting agent? Zinc phosphate cement, resin cement, zinc oxide eugenol cement, glass ionomer cement. Answer is 3, zinc oxide eugenol cement. Question 39 is, what is the correct compression to ventilation ratio for 2-person CPR in children? 5:1, 15:2, 30:2, and 10:1. The correct answer is 2. That is 15 is to 2 ratio. Question 40 is mutations in keratin 4 and 13 expressed in the spinous layer of the mucosal epithelium are known to cause which mucocutaneous disease? Option 1 is dyskeratosis congenita, 2. White sponge nevus, 3. Ectodermal dysplasia, 4. Acanthosis nigricans. And the correct answer is option 2, white sponge nevus. Question 41 is which of the following best explains the reason for postoperative sensitivity in a recently placed composite restoration? Option 1, low thermal conductivity of the composite, 2. Excessive fluoride release from the restoration, 3. Lack of occlusal adjustment, 4. Polymerization shrinkage causes gap formation at the tooth restoration interface. And the correct answer is option 4. Question 42 is which maxillary tooth extraction carries the highest risk of an oroantral communication? Option 1 is maxillary central incisor, maxillary first molar, maxillary first premolar, and maxillary canine. Answer is 2. Maxillary first molar. Question 43 is blank is the water fluoridation system recommended for small towns with less than 3.8 million liters requirement per day. Option 1 saturator system, option 2 solution feeder system, portable system, dry feeder system. And the answer is 1 saturator system. Question 44 is which of the following investment material is primarily used for casting cobalt chromium alloy in dentistry? Option is phosphate bonded investment, gypsum bonded investment, silica bonded investment, carbon bonded investment. And the answer is first, phosphate bonded investment. Question 45 is which of the following statements regarding apexification is correct? Option 1. Apexification is performed only on teeth with vital pulps. Option 2. Mineral trioxide aggregate MTA is contraindicated for apexification procedure. Option 3. Apexification promotes continued root lengthening and thickening of dentinal. 4. Calcium hydroxide apexification induced the formation of a calcified apical barrier. And the answer is option 4. Question 46 is what is the effect of beveling a cavosurface margin in amalgam or ceramic restorations? Option 1 is it results in a thin fracture proof margin. It reduces the risk of marginal leakage. It allows for easier placement of the restoration. It increases the retention of the restoration. The correct answer is option 1. It results in a thin fracture proof margin. Question 47 is a tooth with an absence of pulp chambers and root formation and the presence of periapical radiolucency is classified as option 1 dentine dysplasia type 2, 2. Dentine dysplasia type 1b, regional odontodysplasia, dentine dysplasia type 1a. And the correct answer is option 4, dentine dysplasia type 1a. Question 48 is what is common among Relay-Day syndrome, Lesch-Nyhan syndrome and Tourette syndrome? Option 1 they are all viral infection. They are all primary immunodeficiency disorders. They are all pre-malignant disorders. They are all self-mutilating disorders. And the correct option is 4. They are all self-mutilating disorders. Question 49 is a patient present with a symptom of burning sensation spreading upward from the epigastrium to the neck along with dental erosions on the palatal and lingual surfaces. The most likely diagnosis is option 1 ulcerative colitis, gastroesophageal reflux disease, peptic ulcer disease, Plummer-Vinson syndrome. The correct answer is option 2, gastroesophageal reflux disease. Question 50 is in a community oral health survey, what is the most critical step before data collection begins? Option 1 is calibration of examiners, data analysis, selection of participants, and data entry. Correct answer is option 1, calibration of examiners.